The exciting thing that brought me to Cincinnati Children's Hospital was the fact that the Heart Institute was prepared to take ownership of their patients once they reached adult age. And I believe this is the model that is needed more widely across the U.S. to capture these patients from within the pediatric institutions before they get lost to care in the adult world. So how did so many kids get lost to care so we don't know where they are as adults? Well, I think the first thing is that we all like to be optimistic, and if we get a good report from the doctor or from the dentist, we kind of take it that we're good forever kind of thing. And unfortunately with many of these kids, that's not necessarily true. They still remain at risk of complications and even premature death. Cincinnati Children's is doing three things that are not commonly done in the care of adult congenital heart patients and that are going to make a big difference. One is they're going to stop the loss to care of complex children with congenital heart defects who need lifelong surveillance. They're going to educate them. And thirdly, adolescents are going to be transferred at age 18 to an adult program within Cincinnati Children's that I direct and that is going to continue through the rest of their lives.
Once I grew up and got married, bought a house, and especially had my son 2 years ago, I realized just how much more, everything means and how much more important it is for me to stay healthy for myself and for him and for everyone around me as well. Without, follow-up care, since I haven't had to have another surgery, I can't say that necessarily my condition would be any worse, but I would always have that unknown. I'd have that fear that, my heart could go out at any minute, or that I could have a leak that I don't even know about. If there was something wrong, it's going to be caught, it can be fixed, whereas if I didn't come, I would never know that piece.
My parents brought me here because they knew it was the best care, and we just have had such a wonderful experience and cannot be more thankful for everything that everyone has done for us. And we look forward to coming here every 6 months or a year when I have my appointments just to check in. That's just a huge relief because I know that I'm really lucky and people with my condition aren't so lucky.
I believe that Cincinnati Children's is going to show the way as to how we can do better in the future than we have in the past. My name is Dr. Gary Webb, and I intend to change the outcome for the better for adult patients with congenital heart defects.